Good evening, everyone, and welcome to a new webinar episode in collaboration with Affinity, UN Youth New South Wales, and ANU College of Law. I would like to begin by respectfully acknowledging the Gadigal people of the Eora Nation, the traditional custodians of this land. We pay our respects to the elders past, present, and to all descendants who have cared for this beautiful place since creation. We also honour all other Aboriginal and Torres Strait Islander people who are joining us today. My name is Baha and I'm the UN Youth New South Wales Partnerships Officer. The COVID-19 pandemic has greatly changed the way we live. Many of us are facing challenges that can be stressful, overwhelming, and can cause strong emotions in adults, youth, and children. Affinity, UN Youth New South Wales, and ANU College of Law have brought together a panel of distinguished speakers who will discuss how we can ensure the youth are given opportunities to cope and to manage during these difficult times, as well as the unique challenges facing young people related to their use of social media. Without further ado, I would now like to introduce tonight's distinguished facilitator, Tahnee Jash. Tahnee Jash is a UN Kamilaroi Fijian Indian reporter based in southwest Sydney, currently working in the ABC science team covering stories related to health and well-being. She is also the recipient of the 2021 Walkley Indigenous Scholarship, where she'll be working in newsrooms at Junkie and Channel 10 later this year. Before we welcome Tahnee, I would like to mention that Daniel Angus, the Deputy Commissioner of the Mental Health Commission of New South Wales, can't join us today because of unforeseen circumstances. He has kindly apologized and we hope to see him again in the future. Welcome, Tahnee.
Thank you, Baha, for that really lovely introduction. And I would also like to pay my respects to the Dharawal people who are the traditional custodians of the lands that I'm coming to you from, and acknowledge their continuing connection to country and extend that respect to any Aboriginal and Torres Strait Islander people joining us on the live stream today. Tonight, I'm joined by two incredible guests who will unpack and explore some of the challenges that young people are currently facing during this pandemic, with a particular focus on mental health and also how social media impacts this. So I'd like to welcome our first guest, which is Dr. Faith Gordon, who is a senior lecturer in law at the Australian National University, and also our second guest, Jahin Tanvir, who is an amazing youth advocate. Welcome, everyone.
Thanks, Tahnee.
Thanks for being with us tonight. So it's almost been 2 years since COVID-19 has hit our shores, and for some states it's safe to say they've had their fair share of lockdowns, and I think we can say that this pandemic has impacted every Australian in some way. So to kick things off, I wanted to ask you both how you're going during the pandemic and how you think that the pandemic is affecting your fellow Australians, almost being 2 years now since the pandemic started. Dr. Faith, let's start with you.
Thanks, Tahnee. I think now that we're in this phase of Delta, I think the variant has caused many more new issues for us to navigate. I think the first wave of COVID last year, there was a huge focus on older people in our community and people with, health vulnerabilities. And I think that children and young people, the focus wasn't really on them at that stage. I think this new wave of Delta, the new data and evidence that we have, shows that it can be contracted by children. And, we've undergone now quite an extensive period of lockdown. Some states have been in lockdown more than they've been out of lockdown. So huge issues really for many people. And I think the big difference this year is that there is more of a focus now on children and young people with the Delta variant.
Sorry, my mic was on mute there. Very good points, and totally agree with you. Jahin, did you have anything further to add there? And what's how are you feeling during the pandemic at the moment?
Yeah, I completely agree with Dr. Faith about the shifting narrative on how young people are being included in the conversations more this year with more knowledge and education about COVID and the research behind it. I think in general, from my experiences and what I'm hearing from my peers of young people who are attending school, university, it is quite overwhelming because there's a lot of fatigue that's been built up. We've last year when we experienced all this, it was quite new. We were still trying to navigate through the uncertainties of how are we going to get out of this. There was no clear cut plan, but now I think a lot of us are just facing a lot of fatigue, being in such a secluded environment. Our day to day life being completely changed all over again, and it's just at a state where we're just like, can we please get out of this? It's a situation where it's like a cycle where we're receiving the same sort of issues that were faced before, but only being exacerbated. And there was a lot of expectation that we'd be returning to normal. So I think a combination of all that and what Dr. Faith mentioned, the narrative is being changed, and I think a lot of overwhelming situations are being seen, especially with mental health.
Yeah, some really good points there. And you just touched on just then, Jahin, education and, trying to live a normal life, I guess. How do you think the pandemic is impacting education for young people in particular, especially those who are at their more senior end of their years and they're preparing for their HSC and going to university and preparing for their future and their career? How do you think this is impacting on their school life and also, future planning? Can I start with you, Jahin, on your thoughts there?
Absolutely. Well, I think to that, there's just two sides to the coin. Obviously, with everything being online, we're not being able to have the social aspect of learning and learning from fellow peers. I know people who are in the final year, for instance, aren't getting the full experience of HSC and going out there and volunteering and getting the whole extracurricular aspect, as well as the whole classroom environment. I think we can all relate that that environment is quite crucial to our development, how we socialize, finding our identity. So I think that aspect is obviously being hindered with the online delivery system that a lot of us are facing, whether that be in school or university education. But in the same lens, I think we're also finding that the online aspect can be beneficial to a degree because prior to this, the online learning wasn't thought about as something that's feasible for a long term. But now, when we're looking at rural students, for instance, regional students who are able to access online content and finding it more accessible and easier to access than the locational and geographical disadvantages they may have, I think there is a bit of relief in that sense where we're more adjusted to how to learn online and the facilities that are available there. So again, I think there's two sides to that, but I think overwhelmingly a lot of us can agree there is a lot of fatigue to online Zoom meetings, Zoom lectures, classes, but it's just a lot of learning curves there as well.
Yeah, and Dr. Faith? Oh, may have. Oh, are you there? There, we've got you now.
Asked children and young people about their concerns. And for example, the 2020 Mission Australia Youth Survey highlighted that young children and young people were identifying education, mental health, and COVID-19 as their top concerns. UNICEF Australia's study showed quite similar, that 36% of children and young people really were highlighting a lot of their anxiety related to their isolation, their worries about education, and not feeling connected to their friends and their schoolmates. So these were really, really top concerns for children and young people. I think that Australia does have issues in relation to internet access, and the digital divide is evident here as well. There have been concerns that children have reported in relation to parents and guardians and their knowledge and understanding of platforms. So I do think that there's a lot more education needed in relation to parents and guardians as well. And I think Jahin is really correct in saying that, though there are positives to online learning, in terms of, I know in with the students that I teach at university, a lot of people actually feel a lot more comfortable using online platforms to interact in classroom settings. So I think there are some positives as well.
And just thinking about the kind of digital divide that you were mentioning, and getting that support from parents at home when we're coming to the more senior years, where we're looking at HSE and ATAR, where some parents may not have gone to beyond year 10. Do you think we should be looking at different ways of assessing the success of students, and how they should be judged on that, I guess, particularly given the year that we've had and a lot of disruption to learning, and like you were saying, Jahin, just even being in a classroom environment where you learn from each other and you have that discussion and bounce ideas, that being absent can also hinder the learning that the education people are experiencing. Do you think we need to relook at that? Has COVID kind of brought about an opportunity for us to revisit that and look at how we're assessing students and their success? Dr. Faith, maybe I'll start with you.
Sure. I definitely think that we need to visit these issues and have at the heart of that, children and young people's voices and views about how they feel that the pandemic has impacted on their education. And also there is a lot of, perhaps pressure in relation to year 12 and to university and that particular age stage. But also, much younger children are missing very, very key steps in their, their development in relation to socialization at much younger ages as well. I do think that children and young people should be at the heart of those discussions in that education space about, what might be best. I also think that, looking to other places like the UK, they used an algorithmic system to work out, predicted grades, which actually showed an unfairness and disadvantage for some students. So I think that there should be a more holistic approach. I think Jahin probably has some on the ground advice in relation to perhaps what you think young people might want. So I'd be really super interested to hear from you on your thoughts on that as well.
Go for it, Jahin.
For sure. I completely resonate with what Dr. Faith said. I think what COVID has really shown us is that you can't really plan so much ahead, and the traditional methods and conventional ways of how we're determining and defining what it means to be successful or have some sort of leapfrog into the real world and university, it isn't really practical. And I completely echo what Dr. Faith was saying about getting young people part of the process. So that would obviously come with some changes to the curriculum, inputting more design aspect and the more concurrent issues that's going through. One buzzword that I'm always hearing whenever it comes to discussions with young people is co-design. So having young people part of the process whenever we're creating things from the ground up. So letting them know, what are some of the key elements that you've discovered throughout your high school career? What would you have wanted to learn more about? What are some things that you feel like we should focus more about that we aren't focusing? So things like health literacy, culturally and linguistically diverse competence, all these factors aren't really being talked about. Even mental health, to a degree, isn't really spoken about as much as it should be. When we look at statistics and how many young adults are facing mental health issues. So I think allowing young people to have a seat on the table when we're talking about education and how we can redefine that would be a great step. And then also, like Dr. Faith also mentioned, reducing the pressure that comes with high school students in their senior years, because as we all know, and as you realize as soon as you go into university, it isn't the end of the world. If you make a mistake, or if you don't reach the goal that you initially identified, there's an immense amount of pathways and prospects that exist for you. So I think we need to make that more clear and make them realize the realities that do exist in that sense as well.
Yeah, I love that. And I think co-designing is such a powerful word too, and given the years, we're almost at 2 years now, but given the duration that we've been in this pandemic and the impact that it's had on various aspects of our life, I think there'd be a lot of great learnings that come out of that could then inform future ways of looking at the way that we're assessing the success of students. So yeah, really, really great insights there. Jahin, you just mentioned cold communities there, and I think that's a really important part of our community that sometimes perhaps aren't always, I think we need to do better around. And so I think, when it comes to COVID and talking about mental health, it's highlighted the existing issues, I think, around accessing mental health issues, and also accessing mental health services, and also mental health services being more culturally inclusive. So I just wanted to throw to you and just ask, what are some ways you think that we could better support young people who are particularly from cold backgrounds, who are looking for mental health support or advice?
Absolutely. I think CALD communities are one of the communities that are always unheard whenever we come to the conversation on mental health. So I think one of the first things that we have to do, and I feel like a lot of community groups are doing, is taking the stigmas and taboos that exist as a barrier when it comes to accessing mental health services. We're having a lot of conversations, a lot of workshops, which is obviously amazing when it comes to promoting this. But I think the dialogue needs to have a greater focus on the intergenerational gap that exists, because I think we've almost come to a time where we have fostered a culture where young people are able to talk about mental health with their friends, with their peers, because a lot of them are going through very similar situations. But when it comes to the age gap that exists between parents and the child in many multicultural and immigrant families, the conversation is almost non-existent most of the time. And I think the barrier there in them accessing, for instance, a psychologist might revolve around what their parents might think, if their parents might exaggerate the situation, not understand it. So I think an intergenerational and productive dialogue needs to be had in that sense. And that obviously comes through involving community organizations, creating culturally tailored and specific information for parents to understand the importance of mental health, getting community leaders involved, religious leaders, areas where parents and the older generation might rely on, or look to for information. So I think we need to have a collaborative approach in that, and I truly believe that if we can sort of dissect that in that sense and break down the barriers when it comes to the intergenerational aspect, we'll have more young people from cultural communities reaching out and, I guess, just accessing their fundamental needs. Mental health is a right that they have, and it's accessible if you reach out. So I think having that dialogue in that sense would definitely be very important.
Yeah, thank you. Really good points there. And Dr. Faith, did you have any other points there to add?
I think there's so much within what Jahin has said there. I would also reiterate about, in relation to the stigmatization that often exists in relation to seeking support and help. I also think that, we should be ensuring that our mental health service providers and other professionals, that, that profession is as diverse as possible, and also accessible for our students and our young people to feel that they can go into that profession. So I think that, ensuring diversity in the profession would be a really great thing as well. I also think that, various forms of information and advice, whether that be through social media, NGOs using those platforms to communicate to children and young people, can also be really helpful as well in giving some guidance and advice, and can be one step forward in relation to them maybe seeking, further advice if they need it. And I really also agree with all those points that Jahin mentioned about intergenerational, challenges. And I think that is also existing in other parts of the world as well. I really got interested in mental health because I'm from Northern Ireland. It's a conflict, it has undergone quite a lot of conflict. And we had, for a number of years, the highest levels of suicide and self-harm amongst young men in the whole of Europe. Now, the government there have made quite a lot of strides forward. So there has been the appointment of a mental health commissioner. This person's very active on social media and constantly talking and creating, content that's quite tailored for children and young people. So it'd be great to see our politicians and leaders here in that space, maybe talking more about mental health challenges during COVID and how they're navigating that. I think that might make it more real for people as well.
I think that's some really great points there. It's kind of that whole leading by example in a way, isn't it? When you're seeing leaders and people in your community that are, leading by example and doing those things and just making, opening up the conversation to say that it's okay to talk about you might be struggling or you might not be feeling okay, or maybe you don't understand how you're feeling, and that's okay too. But talking about it is the way that you can come to a solution and find a way that will help you navigate some challenges that you might be facing. And that was a really interesting point there, Dr. Faith, I think, when you were talking about, your personal experience. How did you, I kind of want to throw to both of you here, how did you come about learning about mental health and also talking openly about it? What was your experience around that like? Jahin, maybe I'll start with you.
Yeah, I think my experience of, really being open about mental health and the struggles we go through was just having the right environment around me. So I think during high school, I never really spoke about mental health. It was a very competitive environment where, again, we're more focused on achieving, grades and just that whole aspect and how we can sort of get into university. It wasn't until I got into university when I had a good friend circle and they would be very open about what they faced throughout their life as a child. And that really made the comfort levels of me opening up about maybe some things I may be going through or some things I may have faced even more, approachable. And in that sense, I was able to open up, talk about it in an open way. And not only in the sense where we're just sharing, what we went through, we're also talking about what helped us through it. What are some of the strategies that we implemented, looking at the solutions oriented approach on how we can, help a fellow friend who might be going through a certain situation. So I think my journey started from having a very, close knit group of friends that were very comfortable with each other and just able to speak in a very authentic tone. And obviously, I understand that a lot of people don't have that. Friend circles like that may be rare. So I think to foster a culture where we're open to talk about mental health in the young person's perspective, I think is very important. And having a good group of people around you, again, doesn't help. It doesn't not help. I think it's very important to have people that are open about this because, again, it's better than suffering in silence. A lot of people are going through the same thing, so it's better to talk about how we can help each other rather than having individuals who are suffering in silence.
Yeah, really good points. Really good points there. Um, Sorry, am I back now? I think there's a little bit of a lag. Dr. Faith, and what about you? How did you come to, learn about mental health, what it is, and become comfortable speaking openly about it?
Well, I absolutely love the sound of your friends, Jane. I guess my in mental health, I was bullied in primary school, and coming from that kind of the point Jahin mentioned earlier about Australia. At that time, really in Northern Ireland, mental health wasn't really, something that anyone talked about. It was very much, a lot of stigmatization around that. And there were no support mechanisms within the school environment in relation to bullying or children's rights or anything like that. For me, really, I think my parents and that support network were really vital to me at that young age, after many years of that kind of experience. But really, what I decided to do was turn it into a positive, and I wanted to kind of try and make sure that other kids didn't experience what I had without the support of the school. So I got involved with the Children's Law Centre as a teenager. And really, that's kind of been the basis and foundation for the research and the work that I've done to date in my career. So I really tried to turn around a really negative experience into a positive one. And the research that I've conducted, quite a lot of that has been with groups who have been affected by social media, online harm, and also have been bereaved by suicide and self-harm of their friends. So I've worked with and had the privilege to meet lots of children and young people who really are huge champions in their communities and do such great work to help educate and support their peer group.
That's amazing. And I think you could just see the power there of having peers and having that, that forum where you can openly express how you're feeling, and having that support with people who might be feeling the same way or in similar age groups is really powerful and important. I think some really great insights there from you both, and I wanted to thank you so much for sharing and being honest tonight. But we're about halfway through our panel discussion, so we might just take a quick break where we'll cut to the 2015 International Festival Language of Culture's take on the worldwide chorus Heal the World. And for those who aren't familiar, the International Festival Language of Culture is an annual event that celebrates the diversity of linguistic talents from across the globe with the aim of uniting nations. And since 2015, Affinity and Amity College, which is Affinity's sister organisation, the Australian Intercultural Society and Sirius College, has been hosting this annual event each year. So we'll check that out, and we'll come back to further this discussion and look more broadly about how social media and digital is also impacting the mental health of young people today.
There's a place in your heart, and I know that it is love. And this place could be much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving. If we try, we shall see. In this place we cannot feel fear or dread. We start a better world. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. And the dream we once lived in will full of joyful faith. And the world we once believed in will shine again in grace. Then why do we keep dragging life when this earth crucify its soul? Though it's plain to see this world is heavenly, Jesus Christ, we could fly so high, let our spirits never die. In my heart, I feel you all are my brothers. Create a world with no fear. Together we'll cry every tears. Hidden nations are these words into closures. We could really get there if you care enough for the living. Make a little space to make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. You and for me. You and for me. For our children. For me. You and for me. For our children. For me. You and for me. For our children. For me. You and for me. For our children. For me.
How beautiful was that performance? And hopefully we'll be able to get back to live events and festivals in the near future. So we've discussed some of the impacts the pandemic is currently having on the mental health of young people. And now I'm really keen to explore the impact of online and the digital space. And, you know, many of us live our lives online, or we're experienced or influenced by what we see online, even more so now in lockdown. But when it comes to Gen Z in particular, who heavily rely on social media platforms and technology to stay connected, I was really keen to get your thoughts around this topic. And Dr. Faith, in particular, the research that you've done around COVID-19 and the digital space. From what I've read, your research found that lockdowns have created increased feelings of loneliness, anxiety, and depression for a lot of young people. So I'd really be keen to find out from you both what advice you would give to ensure there's a balance between staying connected while also looking after your mental health. Maybe I can start with you, Dr. Faith.
Thanks. The music was beautiful. It was lovely to hear that performance. Yes, I conducted research in the first wave really of the pandemic and the lockdowns, and that involved workshops with children and young people, particularly those who have experience of the criminal justice system and out-of-home care. And they told me lots of challenges for them on online spaces. ranging from quite a lot of challenges in relation to unwanted content and unwanted contact. So they've been navigating quite a lot of challenges and increased challenges during the pandemic. And we've seen reports of that quite recently in terms of the police reporting in the media, quite a lot of challenges for families at the moment in relation to online spaces. But those children and young people also said there were lots of positives about online spaces. They find a sense of belonging, a sense of connection, and also it ensured that they did keep those connections with their peer group. They also mentioned about every aspect of their lives going online now. It was ranging from education to play to interactions with grandparents or other family members who live in other places. So I've talked a good bit about how everything has gone digital by default. It's not their choice to play online, but given that many play parks and playgrounds have been out of bounds, that given the public health measures, children have been reverting to online gaming platforms in different forums for all aspects of their lives. That's been positive, but it's also resulted, as the research has shown, in more opportunities for harmful things to happen on those spaces, unfortunately. And that's had many kind of damaging consequences for a number of children and young people.
Yeah, and Jahin, what are your thoughts around this? Like, really just having a balance, like as Dr. Faith said, a lot of it's, I guess, a positive of having access to technology and online social platforms is it keeps people connected, particularly when we have to be socially distanced and you can't see people physically. But how do you strike a balance between staying connected, but also looking after your mental health, especially when you're using technology all day, or like Dr. Faith said, you're receiving some of that unwanted content or seeing some of that content, whether it's like news in the media that it's unexpected and it could be provoking. Just, what are your thoughts on trying to strike a balance between the two?
Well, I think first of all, Dr. Faith's fantastic research speaks for itself. There's two sides to how we are navigating through this digital, I guess, atmosphere that we're confined in right now. I think for me personally, like I'm pretty much glued to my computer screen all day, and then whenever I want to take a break, it's what my first instinct is picking up my phone and scrolling through social media, for instance. So I think it's consumed us in a way where um, this is the first, area that we go to whenever we want to take a break, unless we obviously go outside and exercise. So I think in that way, it is a little negative because we're so consumed and focused on social media, and also the negative side of scrolling through social media for many hours. Recently with the COVID outbreak, a lot of the media articles have been around negative connotations of young people. I've seen so many articles where it's just like, oh, the youth of Australia are ruining it for all, or young people in Greater Western Sydney, aren't doing the right thing. And when you see that on a very oversaturated basis, it can create a lot of mental turmoil where you feel like am I doing something wrong? I'm doing the right thing, but why are they generalizing? So I think the media what isn't helping when it comes to this, especially in the sense where it might be very triggering for a lot of young people, and social media in general. There's a lot of comparing with one another and all these different social factors that already exist. But obviously, there's a lot of adversity to that. But like Dr. Faith mentioned, there's a lot of positives that have come up in that sense as well. When we look at the whole online work life, uni life, um, in normal sense, you'd be completely busy. You'd have to schedule, meetings with people, or if you want to go out with friends, for instance. But now, Zoom, game nights and watching movies with each other on an online surface has increased a lot of people's interaction with one another, because it's become much more accessible. You don't have to find a time to travel, that geographical isolation and barrier that exists for a lot of us to meet our loved ones or friends or people we haven't seen for a long period of time, which has created that social benefit of easily being able to make time for each other. Whether even if it's virtual, obviously it's never going to replace face to face, but there is benefits to that, and it allows relationship communication to foster and really be preserved. So I think again, there's two sides to that, and if we can navigate through the negatives of the constant comparisons and the negative news that we're constantly seeing on social media, I think there's a lot of lessons that we can learn and eventually take out of it once we resume back to the normal functionality that we are always aspiring towards again.
Yeah, that's so true. And so when when we're talking about people staying connected through technology and online, which is really great, especially right now. But what about some people who might not have access to the internet and might be feeling really isolated at the moment? What would be some advice that you would give to them to stay connected or just to look after their mental health? Maybe I'll start with you, Dr. Faith.
I think it's really challenging without the technology for a lot of people, and that may be that they don't have the access to the technology, or perhaps they're not sure how to use it, and the variabilities of it. And we've had some lovely stories during the pandemic of grandchildren, assisting grandparents to navigate, new technologies and things. So there have been some lovely stories in the pandemic coming out in relation to that. I think if people don't have access, it must feel like they're pretty cut off from a lot of people right now. I think one of the key positives in the circle of people I have here and in other parts of the world is getting out into nature and outdoors. So many of this allocated 1 or 2 hours exercise time in Australia. I've heard lots of people relishing the time that they get outside, taking it a bit slower and enjoying nature and the beauty around us. And we just can't get technology. So I think that's what I would say to people is to get outside, to use the allocated exercise time, to take yourself within your radius that you're allowed, that's pretty, and to enjoy the beautiful nature that we have around. And you don't need technology to do that.
Great advice. Nature's a good food for the soul, I think. And Jahin, what are your thoughts for some people that might not have access to internet or technology to stay connected?
Yeah, I think it's quite a challenging position to be in when the whole world is revolving around technology, especially if you're a university student or you're working from home. But obviously, I would echo what Dr. Faith said. Get more connected with nature. I think it's something that we don't really have when it comes to our busy lifestyle. Exercising, meditating, being more mindful. These are things that we really are able to explore once we slow down and really take a step back. So I'd obviously encourage that. I've tried doing that myself when I had more time when it comes to lockdown, and I've found a lot of good benefits to that and just settling my mind. But in the other sense as well, for people that really need technology and are unable to access it, and are not able to receive the functionality of it. I know there are a lot of community organizations that I know of that are providing or sponsoring laptops, for instance, or raising fundraisers so they can provide some sort of device for people in rural, regional, or areas where they don't have access to technology. So I would definitely implore individuals to reach out and to these organizations. I think even if you have a look at social media, there's a lot of links to different sources. I know one for the Multicultural Youth Affairs Network in New South Wales. They have this form where if you need some sort of laptop or are in urgent need of a device, you can sign up, and whenever they have something, they'll send it to you directly. And I think that's a fantastic way of providing for individuals who may not have the sources and they need that for instance, education or a source of income. So if you do need something and you're in dire need, please do reach out to different community organizations, because more often than not, they do have facilities available and different avenues. But overall, I think nature should come first.
Love it.
That's
Really
really. Can
great
I
points
just add?
there too. Sure, sure.
I was just going to add one more point, and it's quite a simple one, I think. But even though we're all wearing masks, and that covers often the smile or the expression that you might give to someone if you pass them in the park, I think that we can still say hello, even though we're physically distanced from each other. I think sometimes. That hello to someone who might be living on their own and not have spoken to anyone all day might make all the difference. So just because we have the masks on, it doesn't stop us saying hey or hello if someone passes by. And I think that's just a little simple thing that we can do.
I love that, Dr. Faith. I think that's a great idea, and you're right, because there are some times where, depending on your role or if you're at university, there might be periods of time where you're not talking to anybody or socializing in that way. So just a little hello, I think, could brighten someone's day for sure. Really, I love that. So the other area that I'm keen to look at is, when it comes to online spaces, there's a lot of fake news, and on social media too, there's a lot of fake news that circulates. Especially, I think we're seeing a lot of that in regards to COVID-19 and the vaccine. And Dr. Faith, in your research, you found that more than half of Gen Z and millennials were actually very aware of fake news and the misinformation relating to the virus. And with this Delta strain on the rise and states trying to increase their vaccination rates, what are some ways people can ensure their information and news sources are reliable and trustworthy? If I can start with you, Dr. Faith.
Yeah, sure. So in the research, children and young people spoke a lot about their awareness of fake news. And they talked about how they kind of, verify and check with, several sources before actually, believing something. So I think this generation are, on the whole, really inspiringly aware, of the need to verify their sources. The social media space is a landscape where children and young people find it more tricky to navigate. The passing on of information that they may suspect isn't quite correct, and there was a lot of concern from children and young people that others might take that information as being a fact. Children and young people had their own news sources that they liked to access, and I think that one thing that our leadership could do is to have press conferences and opportunities for children and young people to actually ask questions and to have their concerns and questions addressed by the leadership. We've seen this in Europe. We've also seen it quite closer to here in New Zealand, where the Prime Minister had a press conference for children and young people. I think those things are things that our leaders could do, and it would provide a good forum for children and young people to ask questions. So I think there are things that our leaders can do. Children and young people often spoke about not really wanting to listen to the press conferences that their parents or guardians listen into every day. We also have to be aware that within the family home, there are lots of, sometimes stresses and concerns where perhaps relatives or people living overseas have contracted COVID, and children and young people, this has really added to their anxiety because of, the anxiety and concern of their parents about relatives, about being separated from loved ones who are elsewhere within Australia or elsewhere within sometimes the same city, but they can't, visit them due to the public health measures. So I think direct information, children and young people being given the information tailored in a way that's suitable for their age group as well is really important. But I think that, my research showed that, they are aware that there's a lot of fake news surrounding certain aspects of the pandemic.
Yeah, I think it's a really important point, and I really like that. having a children and young adults press conference, I think that's a great idea. Having the opportunity to speak directly to leaders and any of those mistruths or just questions that people might have, you can have the opportunity then to address it. And Jahin, as a young adult yourself, what are some thoughts that you have?
Well, I believe Dr. Faith spoke very eloquently on this. Young people, are checking their sources. It's quite easy to distinguish nowadays what might be fabricated or what might be more of a satire compared to what's more accurate. And especially in social media, seeing so many different takes on different matters, we're more reliant and dependent on government websites that we have identified are accurate, up to date, and reliable. So I think in that regard, we're quite actively prepared to navigate through the misinformation. But if I could go one step further in this, I think one area that young people might, or at least I'm encouraging them to do more, is to take a bit more initiative and help the other people in our communities. For instance, our parents or the elderly who may not be able to identify and distinguish between what's fake news and what's accurate. I know a lot of people from cult communities, for instance, aren't able to really navigate through what information about vaccinations are correct or what information might be, there to just confuse people. So I think we should encourage young people to take a bit more responsibility to help out families, whether that be through translations, interpretations, maybe taking initiative to create culturally specific infographics, vaccines, showing them translated videos about vaccinations. Because my experience and from the articles I've read, a lot of people from immigrant communities, for instance, the parents, they don't really understand the need for the vaccination or check in with the presses as much as young people are. So I think that open dialogue and that communication would be very helpful, so that we can continue moving forward and taking the right advice that comes from the healthcare professionals, rather than falling into the traps. And also, even if it's just the act of debunking some sort of myth or misinformation that your parents might be saying, just in a very respectable way, saying this is the research that's there, this is what the government is saying, this is the healthcare professional information, and this is wrong, this doesn't align with that. Just a simple conversation would really eradicate all the miscommunication and any harm from them taking action on this misinformation. So I think just taking a bit more initiative in that sense would also be something I would encourage.
Yeah, I love that. And I'm going to put you on the spot here because I saw an article that you wrote around helping your parents get the vaccine and really kind of tackling or combating some of those mistruths. How did you go about that?
Yeah, so I come from a South Asian background, and a lot of people from this background would know that we rely quite heavily on family members, extended family, WhatsApp group chats, for instance. And in my case, I would see my parents receive a lot of, but they take it, very honestly and to the dot, because one of the family members have shared it or somebody they know have shared it. And so I think I had to really identify that and just have an open communication to say, if you want to know anything about vaccinations, there's, the translated information, for instance, there's videos here that are very easy to understand. So, just again, taking initiative and just say, this is what's right, and this is, more so satirical or not accurate, and why, you should be following this. I think just communication in a very respectful manner, understanding at the end of the day there are parents where we need to be respectful and humble in that sense. But if we see something that's wrong, I think that what the best thing to do is just have a proper productive dialogue with them to ensure that they're not falling into any trap or making any mistakes that could potentially harm them and cause long-term implications. So I think, again, productive dialogue is what I'll continue to enforce and advocate as much as I can.
Yeah, and I think you're a great example of that. Helping your parents navigate their way through all of that misinformation that's circulating the grounds at the moment. So we're coming close to the end of our live panel tonight, and I thought a nice way to end off would be asking you both what some tools or programs that you would suggest people use, especially young people who might be struggling at the moment. Maybe they're feeling isolated or depressed or maybe a little bit anxious because it's been a long year, and also, we're really trying to look for that light at the end of the tunnel there. So what would be some takeaway advice that you would give young people, or maybe even parents that are watching this tonight? Maybe I'll start with you, Jahin.
Yeah, I think the main takeaway that I would advocate for is that there is absolutely no shame in seeking help. There are a lot of free consultations, there are a lot of, services available such as Headspace, Reach Out, for young people, that are available at an arm's length. And it just requires you just to take action on your phone or on your laptop, or even if if you, for instance, if you prefer email conversations or phone conversations. There's so many ways available, and we are in a situation where we need to be a bit more kinder to ourselves. We probably shouldn't expect us to be okay or normal in this instance, because again, this is a global pandemic. This is completely unforeseen. Nobody could have foresaw this in any sense. So please be kinder to yourself and understand that if you do need help, even if it's for the slightest of issue or something that's on your mind, or causing you to feel anxious, please do reach out, because there's a lot of services available. And again, there is absolutely no shame or embarrassment in doing that. They're there for a reason, and it's your complete right to access them.
Well said. Thank you, Jahin. And Dr. Faith, your hot tips and takeaway for anyone watching tonight?
It's really difficult to follow Jahin's great top tips there. I would agree with them all. I think they're amazing, amazing points of advice for children and young people. I think, finding that trusted person to talk to is really key. And I think with the lockdowns, in my research, a lot of children and young people who might be having some challenges in the home place found it really difficult to find that trusted person who was often their teacher. But I would say to children and young people to use, if they can, the platforms and the technology, the helplines. And we've heard from the reports that, the helplines are being used at quite high levels by children and young people. So I'd say to reach out if you can, and entrust that trusted person in your life with how you're feeling. I also think that, we're into springtime now in Australia, and getting outside is really good, as I mentioned earlier. And I also think keeping in mind that the vaccine rates are going up week on week, and we're getting the reports. So this isn't going to, hopefully go on forever. It will pass. And we can think back on how much we've learned during this time period, just how strong children and young people have been in our communities. We've seen, and I interacted with someone on a panel who was talking about children in Aboriginal communities creating signs about hand washing to put up in their community. Children have showed, so much strength throughout the pandemic as well. And I think that's something really to be celebrated, because they've really contributed so much to their communities during this time.
Very well said, Dr. Faith. I think that's a really important point. And the years that follow for young people and children will be a marker of, what a year that they've gone through, and that resilience that they've shown to, carry on with their education and their life as best that they can. And I think, Jahin, just as you've mentioned, reaching out and talking to people and using those services that are there is really important to look, in looking after yourself at this time. So I wanted to just wrap up and say thank you to you both for your time and your insights and your knowledge. I think it's a really important and timely topic that we're discussing tonight, and just wanted to thank you for sharing that with me, and also all the people that are watching tonight, and for being so open and honest. So thank you both. And to finish, I'd like to welcome Ahmet Said Yildirim, who's the clinical psychology registrar, a behaviour support practitioner, and Affinity's youth representative to provide the closing remarks. Thank you.
Thank you, Tahnee. Good evening, everyone. First and foremost, I would like to sincerely thank UN Youth Australia and the ANU College of Law for joining Affinity to bring to light a much-needed conversation. There has understandably been widespread concern about the impact of the COVID-19 pandemic and associated restrictions on the mental health of young people. There is a definite need to ameliorate youth's access to mental health services by using both face-to-face as well as digital platforms. And it's really good to see, as a mental health practitioner myself, how quickly youth and mental health practitioners have adapted to this environment in this day and age. Our most generous thanks to Dr. Faith and Jahin for your valuable contributions, not only to tonight's webinar, but to our global youth community. Thank you, Tahnee, for generously facilitating, and Bahar for the warm welcoming. I believe tonight's webinar is reflective of our shared collective commitment to empowering our youth. As discussed tonight, it is imperative to plan strategies to enhance youth's access to mental health services during and after the crisis. Valuable recommendations for ensuring the mental well-being of youth during the COVID-19 pandemic and lockdown, and the collaborative role required of parents, teachers, healthcare professionals, community volunteers, NGOs, and policymakers were shared and discussed. With the impact of the COVID-19 pandemic on young people's mental health, we must consider both the impact of immediate situational stresses and long-term risk factors in our recovery strategy. Notably, providing a supportive environment for youth will instill hope and optimism for the future, which is more important now more than ever. The role of family and the community continues to be an important support for our youth. Adequate support and timely intervention will be integral to facilitating young people's long-term recovery from the pandemic. It is also important to acknowledge that youth have demonstrated considerable positivity, strength, and working together and collaboration, such as reporting increased compassion and empathy for others. Young people have also shown the capacity to support themselves through actively engaging in a range of self-care and help-seeking strategies. They have also showed innovation and collaboration, as discussed by Jahin, to extend such supports to the elderly, to the less fortunate, and marginalized community members. Finally, humanity has overcome great challenges in the past, and we will definitely overcome this too. If we focus on the opportunities that this pandemic provides, it will shine a bright light and make getting past this a lot easier. Joining an event like tonight shows our shared efforts to improve our community through understanding, respecting, and supporting each other in this difficult time. At Affinity, we have had the honor to share ideas and connect with people from all walks of life during these challenging times. We have once again seen tonight that human connection and dialogue, even though mostly online, continues to serve as a powerful means for health and well-being. Finally, I would like to invite you all to Affinity's upcoming webinar on the 15th of September in recognition of World Democracy Day. Tune in to hear from Dr. Anne Ali, MP, Lydia Khalil, and Dr. Julian Drugan as they discuss whether democracy is in decline or not. To keep up to date with Affinity's webinars, make sure to subscribe to our YouTube channel. Thank you to our listeners and supporters from home, as well as our distinguished speakers. We look forward to hosting you again at another Affinity event. Stay safe and have a lovely evening. Thank you.